Hi, this is Dr. Brian McDonough. I need you to spend about 6 minutes with me. That's it. I want to be respectful of your time. What I'm learning and have learned from interviewing Dr. Claudia Kawas, a physician who literally has spent her career as a neurologist studying people over the age of 90. Dementia is far more than what most of us think it is. And this is a source of optimism. Maybe the best news in the last 3 decades when it comes to dementia for someone who's younger and thinking, how can I make sure I do all I can to reduce the chances of developing dementia. This is very important. I really want you to listen. Obviously, I enjoy the fact that you come to my site. We have lots of interesting news. I'd like you to subscribe. But this particular report, I don't want to get in the way of it. I just want you to listen to Dr. Kawas and what she has to say. And of course, thanks for listening. I hope it helps you.
I think it's really important because one of the things that we've seen in our calculations is that if we were to cure Alzheimer's disease tomorrow, we would at most get rid of 25% of the dementia in this age group. And since the rate of dementia in this age is extremely high, we're talking about an awful lot of dementia with numbers expected to quadruple by the middle of the century. Some of the other things that we found and that now we're starting to turn our attention to, if you look at the 60 Minutes show in 2014, and then 6 years later, 60 Minutes did a follow-up segment. And in that segment, they went and revisited the participants from the first show who were still alive. A couple of them were even celebrating their 99th birthday at that time. But we also saw the brain results of individual was in the first show but had subsequently died. And this individual in the first show, I said, had Alzheimer's disease, and he looked to me like that's what he had. But at autopsy, it turned out there was no Alzheimer's disease in his head at all, but in fact, a condition which we now call late limbic predominant, age-related TDP-43 encephalopathy. We're working very hard on figuring out ways to diagnose some of these other conditions, including late during life, because for the most part, the only condition we have a chance of diagnosing during life in terms of biological markers is Alzheimer's disease. And until we understand how to identify all of those others, it's only in an autopsy study that you realize what really was causing the cognitive problems. A second really, really important thing we've learned that everybody is titillated by is a lot of people who die with fine cognition end up having one or two or three of these things actually in their brain nonetheless. And this is a concept we're referring to as resilience. And we're trying to find out factors that are related to resilience because nobody really cares what pathology I find in their brains. They only care how their brain works and whether or not they recognize their loved ones and are able to do the things they enjoy doing.
And it's interesting you bring that up because I always, as a young boy, thought, oh, we need to find a cure for cancer, as if there would be one magic bullet for cancer. And then, of course, as you go to medical school and you learn there's many
Mhm.
causes for many cancers, and it isn't just one cure. And I think we've all been, to a large extent, saying, well, we got to find a cure for Alzheimer's. And certainly work needs to be done and continue to be done to fight Alzheimer's. But the fact that there are many different things doesn't surprise us. Is vascular dementia an issue as well too? Like little micro infarcts. Have you seen that be a big player?
So this is my favorite topic. I mean, probably about a decade ago now, we actually showed that microinfarcts, if we detected as few as three microinfarcts in the brain regions that we looked, which probably represents a load of hundreds of them, though. There was a strong relationship. And microinfarcts to physicians and neurologists, we generally consider to be um, you don't know when they have them. They're not symptomatic. They weren't considered particularly important. And yet now we realize that they're strongly related to cognition and in particular dementia. But I think even more interesting has been lately, we have seen that even when we don't find microinfarcts or big infarcts, that things like atherosclerosis and arteriosclerosis in particular are also strongly related to dementia. In the old days, we used to say dementia was hardening of the arteries, and I kind of feel like I'm going back full circle to that. And when we looked at the analyses that suggested that dementia, if we cured it, of Alzheimer's disease, would only get rid of 20%. When we did a similar calculation for all the vascular lesions, including microinfarcts, atherosclerosis, or an arteriosclerosis, it actually is about 40% of the attributable risk. That's actually very exciting because I think it gives us a potential place where we can intervene to maybe reduce the burden of dementia, even with some of the things that we already have. And in fact, probably some of the decline that we've seen in dementia in the last 20 or 30 years has been because of control of vascular risk factors, particularly hypertension, high cholesterol, and other things. So I think vascular disease is really the most important thing that we need to start understanding much better. It's not just big strokes that cause dementia. All these small vascular lesions that we kind of think are not good or are risk factors for strokes and other things actually in and of themselves appear to contribute to loss of cognition and aging.
Dr. Kawas, thank you so much for your time. I know how busy you are, and I appreciate it.
Oh, absolutely. Thank you for inviting me.